Good morning, everybody. It is 7:28 right now, and welcome back to Iowa Live. I am surrounded by orthopedic surgeons here from Broadlawns Medical Center. I want to introduce you to all the players here because we really have an entire staff that is here joining us this morning. Shri Somasetti. Dr. Shri, good to see you, sir. And thank you for joining us. We've known this guy for a while. Dr. Scott Neff, he is here with us, and Theron Jameson. Dr. Theron, thank you for being here. Appreciate that. And we want to talk a little bit about the things that are offered over at Broadlawns Medical Center, because there are some things that are going on when it comes to orthopedic surgery that is amazing, and innovative new low opioid total joint programs that really minimize the use of addictive pain meds. And this is a really serious problem that we're having, is people do have these surgeries, Dr. Neff, and then next thing you know, they're addicted.
We're trying to put together a team approach with anesthesia, pre-op people, surgeons, post-op people, where we put together the same protocol that each of us use, same medication, same protocol, same anesthetic blocks for opioid naive patients. In other words, people who are not addicted, for total knee replacements or other big surgeries. And the whole point of it is to cut down on the amount of narcotic medications afterwards.
Okay.
And this is a national problem, as you know. People need medication after something. They get too much of it, they get hooked, and then we got a mess. So we're trying to cut down on the need for opioids after, for example, total knee. And if we're lucky and can get it to work, we're going to write it up and get famous.
Right, that would be a great idea. And this guy is pretty famous for putting people back on the mend. We've known this guy for a long, long time. He has put together and put back together so many race car drivers that we can imagine, from the Terry McCarrolls of the world. He's like your best customer, isn't he?
He is.
Yeah.
He's a frequent flyer.
He's a repeat customer, frequent flyer. But the reason is because you're so talented at what you did. But the thing is, you have a larger staff now, and that's the thing that is most important, isn't it?
I came to Broadlawns 7 years ago, and it was pretty lightly staffed. We're now lucky to have 3 orthopedic surgeons now, each of us bringing to the game a special interests and special backgrounds, and it's just really a thrilling change.
That is really neat. And now I want to talk about the opioid situation again. Why is it that the opioids really get a hold of somebody and don't let go once they grab a hold of somebody?
Well, they're very addictive medications, and when you have acute pain, the addiction potential is slightly less, but as soon as your acute pain starts to settle down, just in a day or so, you need to be off that stuff. And people are just used to getting too much of it, and we're trying to change that. All
right, and you said mainly, you said the knee was the one that you mentioned here first and foremost. Is that the most common surgery that you have?
Well, we do 3 times more total knees than total hips.
Okay.
But we just decided to pick one thing and focus on that, and if we could make a change there, and then expand it maybe to other procedures. But total knee is a painful operation. It's a big deal. It takes a while to get over it, and we're trying to teach people beforehand, get them ready for it, do physical therapy and all this stuff beforehand, so that they expect some discomfort but not pain, but know what we're trying to do.
So what do you put them on if it isn't the opioids that we're talking about after a day or two, when the increase goes down?
There's all kinds of non-opioid medication, anti-inflammatories, Tylenol, ice bags, ice circulating machines. We're getting a machine now where we can deaden one of the nerves around the knee, and the deadening of the nerve lasts for a couple months.
Oh, it does? I never heard that.
That's pretty slick.
Yeah, okay, no, so you mentioned hip, so let's talk about anterior hip replacement, Dr. Jameson, with you, and the recovery time involved with this.
Well, the recovery time is so much less because you're not taking muscles and tendons off the hip joint. You're moving them out of the way. So with this procedure, compared to a standard technique with a total hip arthroplasty, patients are leaving the next day after surgery.
The next day?
They're walking the same day and leaving the next day after surgery.
How soon after surgery? You said the same day. How soon? How many hours are you talking?
As soon as the anesthesia wears off, the spinal anesthesia, physical therapy is walking them. So within 4 hours after a total hip, they're walking them in the hallways.
No, go ahead, Dr. Neff.
When I started...
I was going to ask you this. Go ahead.
When I started, of course, Custer just came through town. When I started, total hip stayed in bed for 3 or 4 days. They were in the hospital for 7 to 9 days. this guy's got them walking in 4 hours and they're leaving that afternoon or the next morning. It's just spectacular.
And how active is a person? Because that was one of the things people were most concerned about is with the hip replacement is being incapacitated for a long period of time.
Correct. And so we have found that the sooner we get people up and get them walking, the sooner they're on to recovery and out of the hospital. And that's the most important thing, getting out of the hospital as soon as you can.
Right. So again, just an amazing thing, the advancements that have been made. And Dr. Shree, I want to talk to you a little bit about some of the other things that are offered. We're talking knee, we're talking hip. What else do we have?
We also do shoulder surgeries. We do shoulder replacements. People who have massive rotator cuff tears. We also have a procedure called reverse shoulder arthroplasty, which is picking up recently.
Yeah, what is that?
So when you don't have the proper muscles controlling the shoulder, and if the rotator cuffs are massive, the reverse shoulder replacement essentially takes over the function of the shoulder to compensate for the lack of the muscle function. Plus, people who already have some arthritis is probably the best procedure. However, there are some limitations. You cannot do the overhead lifts and heavy lifting, so it's probably not ideal for people who do heavy labor work. But if you want to have a good pain relief and good functional result without doing the heavy work, it's probably a good bailout. But we still would recommend fixing the rotator cuff tears sooner than later. Apart from that, we take care of all the general orthopedic stuff, including bursitis of the shoulders, tennis elbows, carpal tunnels, pinching of the nerves around the elbow.
No, I want to stop you with carpal tunnel because so many people are experiencing the carpal tunnel syndrome, is that what they call it? And what kind of relief can you offer them?
I think there's a 98% likelihood that they will do fine immediately after the surgery, but I always tell patients that it may take a few months for them to get full functional recovery. And it's also important they address their carpal tunnel sooner than later. If you had symptoms lasting longer than 3 to 6 months, and if you start having weakness in your fingers, you probably have to get it checked out appropriately. There are some special nerve study tests to find out the extent of damage or pressure on the nerve, and before it gets on to damaging the muscles, you may as well want to fix it before. It's a very small procedure. Most of the times we do it under local anesthesia. It takes about 5 to 10 minutes.
That's it?
Correct. And that's the most gratifying part. People who live with these symptoms for years and years, hard workers, they may not know, and this is such a simple procedure.
Wow. And when they do have the surgery, you said it takes that short period of time. How soon before they're able to use their hands again?
For normal stuff, operating a computer keyboard, they should be able to do right away, including driving.
So they should be able to drive home after getting
not
surgery?
Not the same day, but they will be under some narcotic medication.
Oh, okay.
So,
that's the reason you want them driving home. That makes a whole lot of sense. Okay.
Yeah. Starting next day.
The next day.
Yeah.
They should be functional.
Yep.
So this is really advancements, Dr. Neff, being able to change everything from from weeks in bed or in weeks not being able to do something to we're talking hours now.
Yes. The other thing Dr. Sama said I didn't mention that we're grateful for him to do, Broadlawns now has a downtown clinic called Cityville, and we have a clinic over on East University, both of which are brand new. So he's bringing orthopedic care to those clinics right now with staff, and then if they need tests or surgery, then they come to the main hospital. But that's going to broaden our outreach to a whole lot more people and make access easier.
Okay, so now where are you based out of? Are you based out of the main hospital?
I'm based out of the main hospital.
Okay, and doctor?
I'm based out of the main hospital.
Okay, and
I do see patients in all the 3 places.
So you go to all different, okay, now how has the new location, the one near downtown, how is that working out?
Haven't started there yet. It just started last month, so we are trying to figure out the schedule, but I think we are going to start pretty soon. Me and Dr. Jameson will be there.
Okay,
and
that is awesome. And on the east side, tell me about the east side, because we saw that thing going up, and it's always busy.
Yes, East Side Clinic is up and running. I'm there Tuesdays and Thursdays. And right now I'm doing half a days, but we will probably push it up to full days on Tuesdays and Thursdays. The waiting time to get in to see any one of us should not be more than a week. I think that's the advantage of...
Oh, that is really a nice change of pace than having to book months in advance.
Yeah, and most of the times when the nurses call about something which is really urgent, even if it's any one of our patients, we work as a team. You know, between the three of us, we almost have 80 years of experience.
Wow.
And if you're talking to me, you're talking to the rest of the two, and vice versa. We are there.
That has to be such a.
I've hidden my cane.
I was going to say, and you said 80 years experience. What 75 are yours, right?
Not all mine. No, not all mine.
How long have you been practicing?
35 years.
35 years. Amazing, amazing performance.
I got out of the Air Force and came home in 1982.
Well, thank you for your service in both the Air Force and for everything you've done to make people feel better.
It's fun to watch this evolution. It's pretty exciting.
All right, so, and this is all at Broadlawns, folks. We told you Broadlawns new and exciting. This is not the Broadlawns people think of right off the bat, but you should, because Broadlawns has some of the best care you can find anywhere in the country. And now, Dr. Shri, 3 locations to serve you, right?
Yes.
Okay, tell everybody where they're located.
So the East Side Clinic is on the university, just east of the Anderson Erickson.
Easy to find. Yep.
Easy to find. The downtown clinic is on the 9th Southwest Street.
Just on the other side of the bridge.
Correct.
From downtown.
Correct. And the Broadlawns, the main location, it's on the Hickman.
People know where that one is too. Doctors, thank you so much. Good to see you, sir.
Good to see you.
Appreciate it. Thank you so much for being here. Thank you for everything you do to keep our community happy and healthy all year long.